Hello, my name is Craig Mitchell.
I'm Dan Bensky.
And this is a video introduction to a seminar series that we're doing called The Core Clinical Concepts of the Shang Lun. I began studying the Shang Lun when I started studying Chinese medicine in 1990.
I started studying Chinese medicine in the early 70s in Macau.
And I think that Dan and I had a similar experience when we started studying, in that the Shang Lun seemed very difficult to understand and very confusing in terms of how to apply it in clinical practice.
Actually, I think in my school, Craig, the Shang Lun was not a significant part of the curriculum.
So for me, after having mostly dismissed the Shang Lun during my studies, I went back to it at a later time when I began doing the work with Nigel Wiseman and Feng Ye that later became the translation of the text that was published in 1999. And it was during that process that I realized the utility of the text. I started to understand some of the concepts and to be able to apply it clinically.
Yeah, it took me a bit longer. I went to Taiwan in the mid-70s, and Shang Lun is very big there. People told me about the text, that I should read it, and I read it. And after reading it, I thought it was just a kind of historical oddity of no particular application to the modern time. And then when I went to China in mid-80s, I met people who used it as part of their clinic, and they were excellent clinicians with great results. That made me think I made a mistake. And going to Japan also in the late 80s, I saw people who did a lot of work with the Shang Lun. And then maybe the thing that really pushed me over the edge to take it seriously was in the work we did for the first edition of the Formula and Strategies book. And there's a huge number of the formulas were from this book, and so I should make an effort to learn more about it.
And so Dan and I both have spent many years, probably more than 15 years, trying to teach other people how to understand and use the text and use the material from it. And during that process, we discovered that it's actually difficult to do so, and we both have spent many years feeling like we're not teaching it very well and having a hard time trying to understand how to convey the utility of the text, still being true to the spirit of the text, and actually help people become more clinically effective with it.
That's right. I helped my teacher and colleague Ma Shou-chun, who will be joining us later in this seminar, to teach from the early 90s, and I did a lot of teaching in Shang Lun since then, and maybe for the first 10 years or so I had the sense that I had communicated the information I wanted to communicate, but it had no long-term impact on the students, and that seemed like a waste of time.
We were fortunate, Dan, Dr. Ma, and I, to have the opportunity to study the Shang Lun with Dr. Nie Huimin in Beijing, doing work on a PhD. And it was during the time with Dr. Nie that I started to have an expanded understanding of the source text itself and its clinical utility, even for the patients that I was seeing at the time in my own clinic. And that was a very important moment in terms of beginning to understand maybe a better way of presenting this material to the students that I had at the time.
So we developed a seminar series in conjunction with our colleague Arnaud Verslois that we called The Core Clinical Concepts of the Shang Lun. And we had the opportunity to teach this throughout the United States, Europe, and Australia, and it turned out to be a very, very useful and I think quite appropriate way to teach this material to a modern Western audience.
And in fact, we discovered that students who had taken our course had a couple of things that happened. One was that they were able to go into clinic relatively quickly after the courses and use the formulas and the concepts of the Shang Lun more effectively right away. And there was a long-term benefit as well.
They were able to actually kind of, as this information percolated through them, both from their own practice, looking back and forth between what they saw in clinic and the text, and kind of mulling this over and working with it, over time they really got a better understanding of Chinese medicine in general and how to treat their patients specifically.
So it seems to us that this approach to learning about the Shang Hanlun and its core concepts has a great deal of utility for modern practitioners in the West in terms of making them better able to treat patients and better able to treat a wider range of patients.
And so welcome to our course on the core clinical concepts of the Shang Hanlun.